Hello and welcome to Equine Influenza, which is today's disease of the day for Equine Health Week in November 2022. My name is Richard Newton. I'm from Equine Infectious Disease Surveillance, which is based at the University of Cambridge with generous support from the UK's thoroughbred racing and breeding industry. So turning our attention to equine flu, this has been recognised through history because it's a highly contagious respiratory disease of horses, marked by fever, horses going off their food, developing nasal discharge, and most characteristically having a hacking, harsh, dry cough. Usually there's low case mortality, but rapid spread is often a cardinal feature of this disease as it goes round a group of horses. As with avian influenza that we're hearing a lot about at the moment, the H5N1 virus, so equine influenza has its own number. And we refer to H3N8 equine influenza, which has been recognised since 1963 and still circulates amongst horses today. We have seen other viruses infecting horses. H7N7 was one which seemed to have died out around 1980. And what this tells us is that the horse may yet encounter different types of influenza spread from different species, including particularly birds. But that's not really what we're talking about today. We're talking about the H3N8 virus, and that is recognised in the horse industry because of its ability to rapidly spread, signs going through and between groups of horses. And the disease will often spread when horses are moved and then mixed with each other. So it will affect horses attending different types of events, shows, going through dealers' yards, going through sales, going to race meetings, competitions, etc. And this is especially true where vaccination is not used and is not mandated within those animals. And we've been seeing that very recently. Since fairly late in October, we've seen equine influenza appear in the UK linked to sales of horses and then subsequent dispersal from those sales into different premises. This is indeed an international phenomenon and doesn't just happen locally and regionally. As we've seen, we can see flu imported with horses from Europe and elsewhere, and occasionally we do see it spreading further afield transcontinentally, as happened with the introduction of flu from Japan in Australia in 2007. So it's true to say that whilst influenza won't kill horses, it can certainly significantly affect equestrian activities. So really 5 key points to take away with equine influenza is its highly contagious nature. The rapid spread of signs, even amongst vaccinated horses, is important. It relies on infectious spread. Chains of transmission, one infectious horse to a susceptible and on. There is no carrier state as we see with strangles, and there's no latent infections as we see with herpes. So those chains of infection, contact between animals is important. It will often track with the movement and mixing of horses, and that is ideal when we don't have vaccination employed to try and reduce the impacts of it. So, as we've said, vaccination is key to the prevention and control, but as with other influenzas, they evolve over time, and those vaccines do get out of date and need periodic updates. And so we do see equine influenza affecting non-vaccinated horses predominantly, but it can occur in vaccinated animals as well, and we need to be alert to that when it's happening. So, going back only a few years, we saw a major outbreak of equine influenza in the UK in 2019. And in fact, this was the biggest epidemic of this condition that we'd seen in Europe for the past 30 years. It's likely that low national vaccine coverage and poor compliance with preventive measures probably contributed to that epidemic, which had appeared in sort of 2 waves, early on in sort of February and then later on over the summer months. We did see some equine influenza being confirmed in properly vaccinated horses, and that has led to the strong recommendation that booster intervals for vaccination be increased, as this is one of the major contributors to improving immune levels across the herd and protecting animals within it. So vaccines do remain the most single important intervention that we have for protecting equine populations against equine influenza. But key to that is surveillance and sequencing of virus, monitoring how it's changing over time and how effective that vaccine is working against it. We do see vaccine failures periodically, and that's when vaccines will need to be updated. So, as we've seen in the last few weeks, please remain vigilant, particularly if you're taking horses on from sales or events. They appear within only a few days with clinical signs, coughing, nasal discharge, they're going off their food, and they may well be feeling very unwell. Call your vet, get that disease investigated, and find out if it is equine influenza that's causing the problem. So, thank you very much for your attention, and enjoy the rest of Equine Health Week.